episode of Lunch with Experts. Today's expert is a senior faculty in the UCLA School of Dentistry Restorative Department. He has been practicing dentistry for almost 45 years and has many achievements. So presenting to you, Dr. William Morgan.
Hi.
Doctor, nice to meet you. I'm really excited today because our today's topic for discussion is Dr. Morgan's favorite subject, gold restorations. I know how much you like it, and I know that you're the father teaching us all about it. So I was wondering, in spite of gold being such a noble metal, it has the longest longevity, substantivity and everything, but why is it still not widely used by dentists?
It has a lot to do with aesthetic issues, how it looks. People don't want to have gold on their teeth, makes them look older, it's not attractive in the mouth, and that's one of the reasons. And then another reason is for partial veneer golds, things that aren't full coverage crowns, it does take more skill. It's more challenging technically. It's a lot easier just to do a full coverage crown than it is to do something that you have to be a little bit more creative, do a little more thought, and so it's a combination of.
So how is the tooth preparation for a gold restoration different from all the other like ceramic and or porcelain restorations?
Well, a gold restoration, if it's a full coverage crown, is not all that much different than a metal ceramic crown or an all ceramic crown. The difference is the amount of reduction that's done. You need more reduction for one that has ceramic usually, although that's changing somewhat now with some of the newer ceramic materials are stronger. But the ceramic preparations are usually more aggressive. A little more tooth is taken away.
Mm-hmm.
For the partial coverage ones, the difference comes in how the restoration is retained. The ceramic ones are retained through bonding to, adhesive bonding to the tooth structure, and so it doesn't require the same mechanical properties as a gold inlay does. Gold inlay is retained by just cementing it in. It's not bonded in.
So do you need some additional retentive, like grooves or slots?
Sometimes you need grooves. Sometimes you just need a very precise fitting crown that has some nice long walls or a box or some mechanical retention.
Right.
Gold restorations are retained mechanically. All ceramic restorations are micromechanically by bonded. They're both mechanical,
Mm-hmm.
but it's bonding and so another thing that's different in the preparations, you need a little more bulk with the all ceramics.
Mm-hmm.
So, because it can break. Basically, all ceramic is just a glass, and the glass can break.
Right.
Gold will not break, it will bend and it will wear, but it's not going to break. And so you need a little more bulk for an all ceramic. And then internally, you need things a little bit, the design of the tooth, the preparation is a little bit more softer, it's a little bit more rounded internal, because the sharper internal angles sometimes can create stress in the restoration. So you don't need it for retention because you're going to bond it to the tooth. So that's how basically the two differ.
Right. And how about the aesthetic concerns that the patients have when you're doing like a gold inlay or onlay? How are you going to consider the aesthetic concerns? Like for example, if it's the first premolar for the maxillary, so when the patient smiles, like, how are you going to work around that?
That's so dependent upon patient's preference. Some people don't mind showing a little bit of gold on a premolar. Other people clearly don't want to show the gold, and if you can do the preparation in a way that the gold doesn't show, then it's going to blend in. You can also do the preparation in a way that it blends with the remaining tooth structure, and so it doesn't stand out.
Mm-hmm.
But if you clearly have to go clear out onto the facial of it, then it's going to show, and then it becomes a choice of whether the patient wants to show it or not. So if you talk with them up front about where you're going to have to go with it, and show them in their mouth where it is, and they get to decide at that point whether they want to do gold or ceramic. If the gold is going to be an issue, then you go to a ceramic.
And if you consider the cost factor?
The cost factor in the immediate placement or over the lifetime?
Lifetime.
Okay.
For sure. Long term.
Certainly not all gold restorations are going to last a lifetime, but if done well, they can last a long, long time. Much longer than any of the direct restorations, and probably longer than the ceramic ones will.
Right.
Because they don't fit quite as well. There's a potential for leakage, staining, and breakage, although that's happening less and less.
Right. So we have all those issues with ceramic compared to gold.
Cost-wise, there's probably not a lot of difference in the initial placement.
Right.
And again, if done well, both the gold and the ceramic can last a long time.
Right. Well, do you have any tips for the practicing general dentists out there to learn some skills and to master gold restorations?
If a person really wants to learn how to do conservative gold restorations, you can certainly go to lectures, you can listen to what people have to say, but the only way you're going to learn is by doing.
Right.
You're going to have to do it, and the best way to learn how to do that is through the study clubs, where you get together with a group of like-minded dentists, and there's a senior dentist who's a mentor. Typically, there's anywhere from 10 to 12 dentists that practice, that do that probably 8 times a year.
Right.
And they practice their technique, and they get some feedback, and it's a lot like going back to dental school in a way. And
Right.
you get to learn how to do things, and then you share with each other. You see what this person did, and you see what that person did, and you see different ways of handling situations. But study clubs are probably the best way to learn how to do that. If a person is so inclined, the person wants to do that. Okay.
Thank you so much, Dr. Morgan. Thank you so much for your time. I hope you enjoy your lunch.
Well, thank you. Thank you very
And it
much.
was so nice to have
Okay.
you. Thank you.
We'll see you.